first of all, I would like to thank MegaGen company and MegaMind team for providing an opportunity to be here on this stage among such huge specialists in dentistry. And for me, it is a big honor to be in the final part of MegaMind World Competition. So, my name is Антон Добрицкий. I am a prosthodontist from Belarus, and together with my colleague Vladimir Shelik, we are focused on the total rehabilitation of the jaw, implant-supported rehabilitations. Carl Misch in 1993 presented to Dental Society the classification of prosthetic construction, and we are mostly interested when we speak about implant-supported rehabilitation. We are more interested in two types of them. FP3 type, the first one, it's about manual technique, it's about freehand implantation, it's about artificial gum. And the second one, it is FP1 type of prosthetics. It is more difficult, more aesthetic, it's about digital protocol, it's about navigation surgery, and it's about the milling process. And today we will speak about FP1 type of construction as the most aesthetic one. So my clinical case is about a beautiful woman, 42 years old, reference patient, that came to our clinic more or less 2.5 years ago for total rehabilitation, for implant-supported total rehabilitation. If we ask AI to enhance a little bit, AI will draw the teeth to our patient, because it is the simplest way to enhance a little bit the photo of our patient. But if we will speak as a specialist, what can we see on her face? It is, of course, the gingiva smile, so-called. You can see the alveolar ridge during the white smile. It is helps us very much when we try to plan the total implant-supported rehabilitation. If we will examine the oral cavity, we can see the destroyed teeth on the upper jaw. But for us, as for practical specialists, presence of tooth roots is a presence of bone volume of alveolar ridge, is the absence of vertical bone defects on the upper jaw. The first part of our work is, of course, digital workup to see the final result of our final reconstruction. The next is examine of the CT. There is no difficulties, there are no problems in the front zone of the upper jaw because of the presence of the tooth roots. Unlike the backside of the maxilla, where we have lack of bone height, nearly 4 or 5 millimeters. And in previous years, and 5-10 years ago, it will be some problems because we need to have some big bone grafting procedure to place implants directly in this region. It's the region of the first or second premolar. So the first option was the bone grafting procedure or placing the angle abutments with the angled multi-unit abutments. The angle implants with angled multi-unit abutments, so-called pterygoid implants. But for many surgeons, it's quite difficult procedure. It's quite traumatic procedure for the patients. And nowadays we receive how to fix this problem. We use MegaGen ultra-wide, ultra-short implants as a distal support of our permanent and temporary constructions. And it is more important that literature shows us, a lot of articles shows us that in long-term and middle-term period, it is as effective as traditional ways of placing regular size implants with bone grafting. Then for collecting all information in 1 3D stages, we need fixed points on the upper jaw. In this case, at least 3 fixed points. In this case, we placed 3 palatal tracers as a fixed points on the upper jaw. And now we are eager for virtual implant placement. We decided to make 8 implants, to place 8 implants on the jaw of this patient, because it is very young patient and we need to have not only aesthetic, not only functional, temporary and permanent result, but good for everyday hygiene, and the most important, repairable permanent construction to our patient. So the 6 implants we placed in the front zone of the upper jaw, in the region of first incisors, canines, and first premolars. And it is very important to place it slightly palatally to preserve as much alveolar ridge as possible and as much fixed gingiva as possible. And the next one, when we plan placing implant, they should be as parallel as possible, as symmetrical as possible, submerged due to the VLC concept, and aligned in one prosthetic plane. It is very important from prosthodontic points of view. When we speak about complex cases, we know or follow one rule. Everything in complex cases should be made as simple as possible, but not simpler. That's why we place in the distal area short and wide implants as a distal support, and it is very effective. And we draw, in this case, only one surgical guide that gives us opportunity to place implants in those positions that we need. Only one, with 2 passive pins in the front zone and 2 active pins in the distal part when the bone is very soft. So we are eager to surgical procedure that was performed by my colleague Vladimir Shevik. Step by step, harvesting soft tissue from the tuberosity of the maxilla, then gentle removing all teeth except those teeth that we need for placing the surgical guard, fixation of surgical guide, and of course traditional navigation implant placement. The next step, it is contouring of the bone with the instrument from the sinus lifting kit. Placing direct multi-unit abutment. This is very important when we speak about aesthetic zone, to have only direct multi-unit abutments, and in this at that time we can change the height of the multi-units to align prosthetic plane. Then soft tissue grafting and filling 2 sockets with the artificial materials. All these measures aimed to preserve as much volume of the alveolar ridge on the upper jaw as possible during our procedure. Then healing abutments and only primary suturing. After it, on the surgical table, we can make scanning procedure with IPG. We think that IPG is the most simple way to have the very precision digital impressions. After 3-4 hours, we can model and mill temporary construction in our clinic, and after 4 hours, we are eager to fix our temporary construction in the mouth of the patient. The last but not least part of surgical procedure is the final suturing with Otto-Zur Ironco sutures. After 2 weeks, I will remove these sutures. And in this case, I removed also temporary construction to demonstrate and examine the situation after 2 weeks of healing. Now you can see what is the result after 2-3 months after the surgical procedure. And we decided in this case to make only milling PMMA construction for as a temporary bridges, because it is simplest way to make very easy to make the temporary construction and well polished with the healthy gum, to receive healthy gum. But we don't stop on this result. After 1 year, we are eager for the permanent reconstruction. So we ask patients to come to our clinic for examination, panoramic X-ray, and to remove the temporary one and place the final construction. You can see the quality of the gum. It is brilliant after PMMA direct temporary construction. Only 3 scans on the upper jaw. I mean the scan with temporary bridge, the scan of coded flex, and the scan of coded what does it mean? It's the gingiva of the upper jaw, also scanning of occlusion, and of course it is very important in digital protocol to track mandibular movement of the patient with scan. And you can see the pre-operation scan and post-operation situation, they are very similar. Why I draw this line? Because you can see that the right and left side are very symmetrical. It is very important for such cases because we plan to make 4 different bridges. We try to separate this construction into 4 different bridges, zirconium 1 with anodized titanium bar. As I said before, when we treat very young people, we try not to make only beautiful and functional result, but to make it repairable and easy for daily hygiene. So it's quite cute for our patient, and you can see the final result of our construction in the next. So I took away temporary bridges, put zirconium 1, zirconium bridges with titanium bars, and fix it with regular megagen screws. Then panoramic X-ray, control 1 panoramic X-ray. It's rather beautiful. And this is the final result that we can receive with such construction. I mean titanium bars with zirconium bridges. And we advise our patients with such constructions, with full mouth restoration, to have professional hygiene every 6 months, and to have to remove every 2 years this construction for laboratory cleaning of our bridges and for professional hygiene around the implant and around the multi-unit abutments, and to use new fixation screws, megagen screws, every 2 years, to replace it every 2 years from our point of view. So this is the end of my presentations. Thank you for your attention. Thanks.
Wow. You know, I often get asked a question. Mark, I'm moving to Philippines or China or Korea. Do you know any good dentists that you can refer me to? I don't know the dentists all over the world, but I tell them one thing. Wherever you go, whoever the dentist is, if they take photos, they're the good one. Would you agree? Now I gotta add one more thing. If they take video,